Nick Reiner thinks his parents' murders is a conspiracy. We just found out he was placed under a mental health conservatorship for 1 year in 2020. New information has come out as to why his psychotropic medications were changed just a month before the murders. Let's get into it. Let's start out with Harvey Levin talking to lawyer Mark Garagos about the latest information that TMZ was able to uncover.
There is increasing evidence that this may have been a meth murder. Let's start off, Mark, by playing the interview that one of our people did with somebody who is well acquainted with the area where Nick Reiner was arrested, Exposition Park.
Is this the place that people come if they're looking for that? Like
every drug I see be over here every night.
Every night.
Yeah, cracking around here.
Now, Exposition Park obviously is lined with like USC. It's the stadiums. It's the museums.
And I just want to say I went to USC and I can absolutely confirm the area all right around campus is pretty dangerous. I mean, there's robberies in the daytime. Forget about walking around at night.
That doesn't deter people.
You don't deter shit. You can find anything you're looking for.
Listen, I mean, where are people like actively like doing that, like grabbing that stuff? And does it make sense?
They doing it right now. You just gotta look around.
Like where? Like
It's cracking over here.
Over here by the freeway?
Yeah, right by the freeway. It's like slow path right here.
Yeah. The encampments right there. And then what about by the school, like and the stadiums? Are they like on the other side?
That's everywhere, bro.
Everywhere. So at night it's a different world, is it?
Man, it's like Vegas at night around this place.
Really?
It's everything lit up.
Well, I mean, are people what can you find out here? I mean, there's like
whatever you looking for, bro.
Specifically like meth. You can get meth, you can get
whatever you looking for, bro.
So, and this is known. This is well known.
I'm not gonna say I know it is.
Yeah.
You do whatever you're looking for.
Well, listen, man. Obviously, I'm curious. You know, have you ever seen this guy particularly? He was arrested a while back.
Right.
The Rob Reiner's son. I don't know if you heard the story, but big tragedy.
Yeah, he does look familiar.
He looks familiar. You might have seen him out here.
Yeah, probably. Yeah.
Listen, man.
And I don't know. I mean, it's just some rando on the street, you know. I will agree that the area around USC, as I said, is dangerous. We used to get notifications all the time in terms of safety and awareness whenever we were walking to and from and around campus. But I mean, obviously he can't confirm whether or not he saw Nick Reiner there multiple times. But again, this is the area where he was arrested. He was found and arrested.
How dangerous is it out here like I'm thinking like a white
dangerous period. Like for anybody, it's not about coming around here. It's like dangerous area.
Like a rich white kid. Is this where like do you see that a lot? Like
see everybody, but like to say all nationalities come around here.
Just because
everybody's welcome.
Just because they already know.
Yeah, it's cracking right here. Just spot the big.
Thank you.
So, Mark, let's just kind of connect the dots here. Nick Reiner was diagnosed with schizoaffective disorder around 2020. He was put on meds that stabilized him. Before that, he was heavy into drugs, including meth. When he went on the drugs for schizoaffective disorder, we're told he was not using illegal drugs. He was taking other prescription drugs that were creating problems.
Okay, hang on. I just want to say I don't recall that he was saying that he was using meth From everything that he's talked about, it was heroin. There's cocaine and heroin, but I think he did dabble. But from what I recall, it was heroin was his main drug of choice previously.
but not meth. That's what we were told. In the month before the murders, they changed his meds because he was complaining about weight gain from the meds he was on. They changed the meds. He went off the rails, and that ended a month later when he killed his parents. Now,
When TMZ first reported on this, I was floored. I was absolutely floored. The only way this makes sense is that yes, weight gain can be a side effect of some of these psychotropic medications, but I can imagine if he was stable, if he was doing well on them for a few years, there there wouldn't be a valid reason that could clinically justify his mental health team changing his medications. Even if he's just now complaining about weight gain, I would say the only way that this would make sense to me is if somehow his medications were previously changed. So I'm talking the murders were in December, and the reports are that his medications were changed in November. I'm talking about if there was a previous medication change from the summer or even as late as August. Um, it would have to be where these side effects are new, that he's all of a sudden he's saying, "Hey, I'm really noticing I'm gaining a lot of weight. I don't like this, and what can we do?" The biggest question here is, was he still using substances during the last 5 years? And I think that we're seeing the more information that's coming out, we can take an educated guess to say that most likely, yes, specifically weed. And we know what does weed do? That affects your appetite. That makes you more hungry. So to me, if this is true in fact that he was upset about weight gain and he's thinking in his mind that it's just the psychotropic medications, why didn't his mental health team speak to him about using weed? How was the marijuana use addressed? How was his diet and exercise addressed? He was in a $70,000 a month outpatient facility that can offer these types of wraparound services where he's able to have a nutritionist and a trainer. And we also know that getting good quality sleep is vital to your mood and your emotional stability. It just does not make sense that his psychotropic medication would be changed all of a sudden because he was complaining about some recent weight gain. There had to be some other factors at play here.
the way he killed them, Mark, was so brutal. It was carnage. I mean, I'm not going to say what we were told, but it is awful, the condition those bodies were in. And we talked to Dr. Drew about this, and he also believes, and we can get into this, why Nick Reiner may have been on meth. And if he was at Exposition Park looking for drugs when he was arrested, that probably wasn't his first rodeo in that month. Here's what Drew said.
The kind of violence that was on display here, to me, still reads methamphetamine. I keep saying that over and over again. It's not enough to have decompensated schizoaffective. The level of the violence.
Decompensation means a severe spike in symptoms, pretty much having a mental break, and this can be brought on if someone is inconsistent with their medication, is using substances, or is dealing with overwhelming stress.
And when he was picked up, it's worth trying to understand, what part of town was he in? What was he doing there?
Yeah.
You know, was he near MacArthur Park?
It was
Was he?
it was a
down.
drug den. It was a
All right.
it was a
Well,
drug den.
guess what? Yeah, that didn't start that night. that didn't start.
Right.
That's probably he needed more and he went to get more. Probably. I don't have any direct knowledge of this, but it's methamphetamine is the drug of violence.
Well, like Drew is saying, probably
So Exposition Park, the USC area, which is where Nick went to allegedly pick up drugs, is about 14 miles from his home in Brentwood, Brentwood is by Westwood, UCLA area. So it's about like a 20-minute drive.
but when you start connecting the dots, Mark, if he was going off the rails a month before the murders, he may well have been doing meth in, a week, 2 weeks, 3 weeks before he ended up killing them.
So for those who aren't in LA, what Drew just referred to, MacArthur Park.
Well,
which
it's
is over
exposition.
by-
It's Exposition Park.
Right. What he's referring to is his historical knowledge. MacArthur Park, over there by Langer's Delicatessen, used to be the kind of outdoor drug supermarket. It's now moved to Exposition Park, which is where you had the reporter that was out there pointing behind him.
Right.
And that's now, it's literally straight down Figueroa from where I'm sitting, that's now the outdoor drug supermarket. And
Now
what
let's
Drew
take a
is
look at this article from Extra. Nick Reiner is delusional, believes he's the victim of a conspiracy. So they're pulling this information from TMZ's reporting. They did an investigative piece. TMZ investigates the Reiner murders, what really happened. Sources say that Nick knows he killed his parents, but he thinks that those keeping him in jail are part of a conspiracy against him. Now, there's no additional information as to expanding on what that means. Who did he say this to? Extra TV's Mona Kosar Abdi also spoke with Harvey Levin about their findings, and he explained why he believes Nick's former lawyer, Alan Jackson, stated at a press conference that Nick Reiner is not guilty of murder. Mona spoke with Dr. Dominic Sportelli, a psychiatrist who has not treated Nick. He shared schizoaffective disorder is a complex mental health illness. People can have delusions, hallucinations. They can't tell what's real and what's not. That combined with severe depression, disruptive moods, mania, like you might see in a bipolar disorder. So, yes, that is criteria for schizoaffective disorder. Check out my video on what is schizoaffective disorder, where I break down and I go through the DSM to go over all the criteria for that diagnosis. Mona asked, can you explain what a change in medication can do to a patient with this disorder? Dr. Sportelli answered, it's a challenging treatment because a lot of times you have to use more than one medicine. In short, if you change the medicines, you're risking a relapse and maybe a decompensation, like Dr. Drew was saying, until you can get them stable again. Now, let's take a look at his mental health conservatorship that started back in 2020. Years before he was charged with murder in the deaths of his parents, Nick was reportedly put under a court-ordered mental health conservatorship. According to the New York Times, Reiner was placed under a Lanternman Petrus Short LPS conservatorship in 2020, which allowed for involuntary psychiatric treatment. Under this type of conservatorship, a conservator or someone close to the patient can decide on medical treatments. A renewal for the conservatorship was not filed, so it ended a year later. Reiner's assigned conservator was Stephen Bear, who weighed in on the killing, saying that mental illness is an epidemic that's widely misunderstood, and this is a horrible tragedy. Okay, so we don't know why a renewal was not filed. It could have been that Nick was stabilized and his schizoaffective disorder was compensated and he was doing fairly well. What is an LPS conservatorship? What is the type of mental health conservatorship that Nick was placed under? LPS conservatorships, named after the Lanterman-Petrus Short Act, is a legal process dealing with people who have been diagnosed with a severe mental illness specified in state law that includes schizophrenia, bipolar, clinical depression, and others. This type of conservatorship is different from probate conservatorships, the type that Britney Spears was on. Under an LPS conservatorship, someone else can make financial decisions and mandate a person to undergo treatment, such as medication. Often, a county public guardian or similar office can serve as a conservator. Temporary conservatorships last up to 30 days, and counties use that time to investigate whether a longer term arrangement is necessary. What's known as permanent conservatorships last up to a year and can be renewed through court on an annual basis. Okay, so this is interesting because it's considered permanent, but it needs to go through it needs to be reviewed annually to continue on. It's up to 12 months. Who is eligible to be under an LPS conservatorship? Someone diagnosed with schizophrenia, bipolar, schizoaffective disorder, clinical depression, obsessive compulsive disorder, and chronic alcoholism. The person must also be considered gravely disabled, meaning they're unable to care for basic needs such as food, clothing, or shelter as a result of their disorder, and unwilling or incapable of accepting treatment voluntarily. How does someone get placed under this type of conservatorship? Proceedings typically begin during a shorter term psychiatric hold. Sometimes a person has been hospitalized multiple times. The county then conducts an investigation to determine whether the person is a danger to themselves or others and is gravely disabled, as well as possible alternatives to conservatorship. If investigators find that a conservatorship is necessary, the county can petition the court, which has ultimate approval over whether to establish the conservatorship. Let's take a look at this graphic on the conservatorship process explained. So we're just going to go down the left side because this is the side that leads to the conservatorship. Everything here on the right is if a person is released from treatment. So a person's held on a 5150, a 72-hour hold. They're admitted to an inpatient unit. The hospital applies for conservatorship while the person's held. Longer-term holds include 14-day stays known as 5250s or 30-day temporary conservatorships. The county's public guardian or public conservator office investigates and files a petition with the Superior Court for conservatorship. The court grants the county's petition, finding that the person is gravely disabled and determining the least restrictive placement. So here is where they would decide the length of the conservatorship. Nick's mental health team would have absolutely known that he was previously placed on a conservatorship, that they knew he had multiple hospitalizations. So why, if they were noticing within the past month, so 4, 5, 6 weeks, that he was spiraling, that he was decompensating, that his symptoms were getting a lot more worse, why wasn't a PET team, psychiatric emergency team, called? Why wasn't he placed on any type of holds? If he's meeting with his clinical team, he would have to do outcome measures, including safety measures. And I've talked about this before, the CSSRS. What was his scale and score on that? Why was nothing done to ensure his safety in those last few weeks? Based on what we know so far, what's been reported on, it does appear that his clinical team did drop the ball here. And as a fellow mental health professional, it's incredibly devastating to see. I'm really looking forward to, once this case goes to trial, I'm really looking forward to the clinicians, psychiatrists, physicians testimony here in terms of their thought process here. How are they monitoring his mood swings and his change in behavior, his change in mental status? All right, that's all I have for you today. I will definitely keep following this case and continue to share my insights on any updates that we get. If you like this video, please remember to give it a thumbs up, subscribe, and share. Take care, and I'll see you on the next one.